Shani, your internationally certified transformation coach and speaker and a dance exploration expert. And we have with your guest who? Mrs. Dr. 𝓵𝓪𝓭𝓪, a physician and medical oncologist at Reliance Hospital. So welcome ma'am to our show today, to our because this month is Breast Cancer Awareness Month of 2024, and ma'am is just, besides being a doctor, I think ma'am is a very compassionate and empathetic human being, a good human being, because I myself have gone through the treatment, and she's really helped me one step at a time, going hand to hand. So I would really thank you so much for all your support. And since this month is the Cancer Awareness Month, tell me ma'am, how do you come to know like the person has got cancer or any type of cancer? Because sometimes you don't even come to know. Patients don't have pain, and by the time you come to know, it's too late, and the treatments may be also rigorous. So what are your suggestion for that?
So first of all, Natasha, thank you for having me. And I just want to say Natasha has been very brave in her journey. And look at you, you've bounced back, and here you are hosting me.
Thank you.
So kudos to the spirit of oncology, and kudos to patients like yourself who are not just survivors but conquerors. And truly, when I sit across you as your doctor, I feel inspired. I truly feel inspired by the human tenacity and the inner strength, which brought me into oncology in the first place. Now, Natasha, to answer your question, essentially, when most cancers are diagnosed, it's already advanced stage. I would say around 2/3 of cancers, all kinds of cancers worldwide, are diagnosed at least in locally advanced or advanced stage. That's because cancer happens inside the body, and there aren't too many telltale signs, and when the telltale signs come, the person has already had presentation of advanced disease. Having said that, it is also a well-known fact that breast cancer, being in an organ that's outside our body, is felt much earlier. So breast cancer is a cancer which a woman can actually self-detect. So it's one of the easiest ways to catch breast cancer is by self-breast examination.
Oh, that's, I guess, a very, very important point doctor made. A lot of women, take granted for their bodies, they judge their bodies and all, but this is very important.
Yeah.
That self-examination for a woman is very important.
It's very important, it's very critical, because when we look at screening, we say monthly self-breast examination, then clinical breast examination, and then mammogram and all of that. So how do we detect a breast lesion? Actually, many times the woman has picked up. So that's the message for detection of breast cancer. Since we are talking in Breast Cancer Awareness Month and we're talking around breast cancer, I think detecting breast cancers is actually quite easy, because it's an organ that's outside our body. Self-breast examination with the palm of the hand, opposite palm of the hand, post-menstrual period is the best time to examine the breast for the woman herself. And any lump that is felt in the breast should be brought to the notice of their doctor. And the easiest doctor a woman has in the community is actually their gynecologist. So they can go to their gynecologist. There's no hesitation, because most of the women have either have had a family or about to have a family. So it's very easy for them to go to their gynecologist whom they have been following, and if they haven't been following, they can see someone new. But then the clinical breast examination happens. So do not sit on a lump. If there is a breast lump felt, seek evaluation. And the easiest evaluation is by the doctor. And then the doctor, once they have evaluated, they can then escalate to additional testing, which would be mammogram, sonogram. And if that flags off something as being worrisome, then it will be biopsy.
Okay, yeah, that's really good. Thank you so much. But how do you know which treatment for which person is given? Because every woman have now, even I have, like, going through it, know a little bit of the negative of like negative 3 or 2 positive, and so how do you know? Because it is very stressful for the patient, and the patient wants to do as less as possible,
I know.
And I know, like, how scared I was when I had to go through the surgery and the chemo. So how do you all come to know?
Right. So that's a phenomenal question. And actually, I would say, yes, when detected with cancer, it is overwhelming. It's really overwhelming, and you really don't know what's the next thing to ask. But I think give yourself a day or two, gather your strength, but you need to ask. You truly need to be aware. So that's where the awareness comes into play. And I say this to patients all the time. Do not put your energy in shunning the treatment. Put your energy in figuring out what is the best treatment.
Okay, awesome. Yes.
So today, cancer treatments are very nuanced.
Okay.
And treatment for all is not the same.
Okay.
That's what is precision.
Okay,
You
that's
need to
why it's called
personalize
precision.
it. You have to be
So it's
precise.
customized according to the patient's
according to the tumor. So the tumor has biomarkers on it.
Okay.
And those biomarkers need to be understood in order to design therapy for that patient. Earlier, all breast cancers, if they could be cut out, would be cut out first.
Okay.
But then the understanding of different types of breast cancers came in, like you were asking.
Yes.
So there's hormone positive breast cancer, there's HER2 positive breast cancer, and then there is triple negative breast cancer. So there are 3 major flags on breast cancer cells. One is estrogen receptor, ER, progesterone receptor, PR, and HER2 receptor, which comes from the HER2 amplified gene, HER2 gene amplification. And if these 3 flags are not present on the cancer cells, then it is triple negative. If HER2 is only present, then it is HER2 positive. If ER and PR are flagged off and HER2 is negative, that's hormone positive. And then there is a variant called triple positive, and all 3 flags are present. And these 3 types of cancers, 3 or 4 types of cancers, breast cancers, behave differently. They have different management, styles of management. So I would say, by understanding what is the biomarker for the breast cancer, the therapy changes.
Okay.
Then comes in stage. So if a person has lymph spread to the lymph nodes, then mostly you start with chemotherapy first.
Okay.
If a woman's breast cancer has spread to the lymph nodes, multiple lymph nodes seen on the PET scan, that woman should first get chemotherapy, no matter which kind of breast cancer she has.
Okay.
So that's also very critical. But if the disease is small, there's no lymph node involvement, then for hormone positive, you would go with surgery first.
Okay.
For HER2 positive and triple negative, you will go with systemic treatment first, which means chemotherapy plus targeted therapy for HER2 and chemotherapy plus immunotherapy for triple negative breast cancer.
Okay.
Sometimes when we have small disease, we have no lymph node positive, then even in triple negative breast cancer, immunotherapy is not warranted, and you just go ahead with chemotherapy and you do the surgery afterwards.
Okay.
And that patient may then require radiation. So I always say this, breast cancer treatment is a marathon, it's not a sprint.
Okay, yes.
It is for a longer period of time.
Okay, and according to you, which one do you think is the worst, like, or if there's no good or bad, like less, because aggressive or more aggressive?
So triple negative breast cancer is considered most aggressive,
Okay.
but now we have therapy change.
Okay.
You know, you give, earlier we used to give chemotherapy later after the surgery, which was the routine style. Now we give chemotherapy upfront. That has really brought about significant difference in the outcomes. We also have immunotherapy for those high-risk triple-negative breast cancer patients who have lymph node involvement. And all triple negatives are also not the same. There are different kinds. One of the biggest factors that is important in triple negative breast cancer is how does the woman respond to upfront chemotherapy. It's called complete pathological response. So if someone has a near complete response or complete response, their prognosis is really good because the chemotherapy was able to kill most of the cancer cells.
That's very important.
Yeah.
And yeah, so it depends upon the patient and but what if a patient cannot do surgery? You know, sometimes the body cannot take in chemo and surgery because every person is different. So what do you all do in that case?
So if a breast cancer patient who is curable is unable to do surgery, then essentially they are maintained on systemic treatment.
Okay.
But that would not be curative.
Okay.
That would not be a curative. For cure of breast cancer, surgery is imperative. Surgery needs to be done.
Thank you so much. It's a lot of information. And this was the treatment aspect. What about how important it is for the patient? You know, the lifestyle changes, the mental blocks the patient has, the emotional support from everyone. How important do you think that is for the treatment? And
I think that has a phenomenal value. I think when we have friends and family to support a patient emotionally, I feel that patient is able to do the treatment much better than people who don't have any family member or friends or next of kin to help. One. Two, I think one should seek support. If you are not comfortable seeking support from random people or your colleagues or people who are a little distant, that's okay. But at least close family members, close friends should be made aware, because the focus should be on taking help and getting better.
yes, that's true.
And you would do the same for them.
Yes, yes.
So if you have those relationships, if you have those ties, I think it becomes extremely important to reach out, take help, because one is battling with a goal, and the goal is cure. So if we are fighting for cure, the goal is only one. And everybody else is an ally. They all come together to help the patient and the doctor
Yes.
get through all the different stages of the treatment and get past that. That's one thing. And the second thing is, I've also felt that in your case it was different. You came from from a significant maturity because of your profession, I feel, and also your background. But not everybody who is single is that mature. So when someone is alone in their journey, we red flag that.
Okay.
Because we feel they will need additional support, they will need additional hand holding, and I have seen actually a lot of women, when they're not well supported, really be lost in the journey of the treatment, and sometimes I have had to switch therapies to make it lighter. Sometimes I've actually had to stop treatment ahead of time.
Okay.
So all those difficulties do arise when we don't have proper social support systems in place.
Yeah, that's when I realized, very important for women or anyone who's going through that. It's very important to have family, friends,
Absolutely.
support system, and share, share with people.
Share the information.
Yeah,
Extremely important.
Because this time the theme, according to the international organization, which I was just seeing on the net is for theme for 2024 cancer is no one should fight cancer alone.
Wow.
You know, so I'm
It's a
just
powerful
seeing,
message.
yeah,
Very
no one,
powerful.
because like you think you'll be healthy till you die, means you die. That's what we all want to, but you never know. Life is very
Yeah.
uncertain. You could just be out walking and just meet with an accident. So anything is possible. So I feel the importance of relationship and family and friends, especially when you're not well, is it
Most
does
critical.
too.
Yes.
Most critical, and also your mind.
Yeah.
Like what do you think of the power of the mind is also very important. How
So I
you are
think
dealing
mind
with
is
it.
most powerful. I think human mind, I feel, is very tenacious, and it's all a mind game.
Yes.
So a patient is undergoing treatment. Yesterday or day before, I came across a patient who had already completed treatment, and so she was coming to see me before starting her maintenance therapy.
Okay.
So she said a phrase. I said, "आप कैसे हो? कैसा जा रहा है? कोई तकलीफ भी हुई?" तकलीफ तो हुई, पर मैं बहुत सारी चीज़ों को ना इग्नोर मार देती हूँ. इग्नोर मार देती हूँ.
Yeah.
That was a conscious effort to block certain things that she said, I am not going to let this affect me.
Wow, I think this.
And when she said that, I just got that sentence and I said, I'm going to remember this sentence. Ignore maar deti hu.
Yes.
That's like, I ignore that consciously, knowing that it is coming towards me and it is going to affect me. I tackle it this way, that I say, okay, this is something that I'm going to totally ignore. I'm
Ma'am,
not going to accept.
We'll have to cut for a second.
Just the battery drain.
We'll just switch. You can continue from the next sentence you wanted to say.
problem.
Sorry.
Mind is ever powerful. I also feel the tenacity of a human mind is exemplary. I think we underestimate it. And I have seen the tenacity time and again. In your case, think about it, how you went through, how you conquered it,
Yeah.
how you championed it. I think that's where how you process your mind is very critical.
Yeah, because I always say that, and
Yeah.
it's an important line when I say it in my trainings, in my lectures, that the best relationship is your relationship with yourself, because you will have people with you for some time, and I'm not saying there's no support, but you are with yourself 24/7. Your mind is working negative, positive in every way. So in fact, I explored so much about myself during the journey,
Yeah.
and I didn't let it affect me. I
Sure.
was busy doing, of course I couldn't go out after certain days. I was busy doing my videos at home. I was painting. Sometimes you don't get time when you're so busy with
Yeah.
work. I started dance on my own, and
Wow.
now I give workshops on dance, and
Amazing.
all these things, creative side came because I was sitting in the house. Because
Right.
sometimes you don't know what to do, when
Yes.
and for me it was like constant sitting in the house, because Corona got over in 2021, and I was like, now I'm free. I was all set, and unfortunate part also, it happened just 2 days before my birthday. So 22 was a shocker, for me, and in overnight, as you know, the cyst developed. But very important question which I always ask, because I do so many things, internal work and all. So why do you think people get cancer? I mean, sometimes people don't smoke and drink. They don't do anything against the law of nature. They are very fit. They exercise well, and before they are detected with cancer. So I know one of the reasons is genetic.
Yes.
But what are the other reasons that could be?
So I'm going to try to explain some, and some of it still, large portion of it still remains unknown. So
Okay.
I'm not going to feign that we know this.
Okay.
So 10 to 20% of breast cancers can follow in families, right? Hereditary or familial. The rest 80% we say is sheer bad luck.
Okay.
Okay. Now what does that mean?
Yeah.
It's a small phrase with which we close the conversation with a patient.
Okay.
But the truth is that under that umbrella, actually, there are so many things. And one of the biggest things that is under that umbrella is environmental pollution.
Okay.
What we eat, how we live our lives, a lot of that is also related to what we presented, especially for breast cancer. We all know that delaying pregnancy leaves a woman exposed to higher levels of hormones, which if someone has multiple pregnancies in their reproductive life span, they can actually shut off on those hormones for a particular period of time, and their chances of getting breast cancer are slightly lesser. So a lot of these mechanisms are there out there where we have the data, but largely how does environmental pollution affect breast cancer? Very limited understanding to that. We are doing a lot of work in terms of food and cancer.
Okay.
But if you really see, very limited awareness exists. And yes, alcohol is a taboo and red meat is a taboo. But beyond that, there's hardly anything to inform. And I've looked at a lot of nutrition researches and really not a whole lot to shun any specific type of food. So what do I tell my patients? I generally say, eat balanced,
Okay.
shun processed foods.
Yes.
Of course, for breast, shun alcohol, shun red meat. Exercise is most critical because now we have enough data to prove that mild to moderate intensity exercise 3 to 5 times in a week actually decreases relapse, increases survival, improves outcomes. And this is already researched and published and reproduced through multiple studies. So if one thing that has really had a stamp now, that's exercising. So a lot of gray area for food, but definitely a positive for exercise.
Yeah, so I think this is a very important point doctor made. We say we don't, like a lot of people say we don't have time for exercise, or we are busy with work, or we are busy with going out or partying, which is okay. I don't say it's not okay, but I say that I'm sure if it's your best friend's wedding or you have to go for an important party, you will take out time. Okay, you will, I'm sure. So why not take out time for your health? Because I always say the best investment is the investment in yourself.
Correct.
And health is wealth, as
Yeah.
we all know,
Yes.
for the fun, like even Mrs. Neeta Ambani always says that, that health is wealth. We might earn all the money in the world, but what's the use when we just can't go out of the house, or
Absolutely.
we don't even have the energy
Sure.
to do so many things. So I think doctor really shared a lot of important information. One last question, which is really important. They always say prevention is better than cure.
Yes.
So what do you think women should do? Whether they have family history or they don't have family history, because I know a lot of women like, oh, no one in our family had it, so I won't get it. So what is your take on that?
So I think that 80% is most critical. I talked about the 10 to 20% running
Yes.
in families, but there's this whole 80% that happens just like that.
Yes.
So no, we cannot say if we didn't have it through the family, we are not going to get it.
Okay.
We always need to remain diligent. Clinical breast examination, methods for prevention or early detection, right? So prevention we'll talk about in a second, but early detection most critical. So self breast examination, and then clinical breast examination. If there is anything that is picked up on a self exam, go to the clinic, see the clinician, even otherwise once a year for sure.
Okay.
Those who have a family history get screened early, but those who don't, at least start screening with bilateral breast mammogram and sonogram from 50 years of age.
Okay.
And those who have cancers in the family but tested negative for germline should at least start their screening at 40
40. Okay.
instead of 50. So these are some basics for breast cancer.
Okay.
But in terms of prevention, I think today the maximum data is to shun alcohol, to not gain weight.
Oh,
I'll come to that in a second. Exercise
okay.
and shun red meat. In terms of food, I say Mediterranean diet. There's enough said about that. Less of processed food. External hormone intake is considered negative. Also, early childbearing for those who are in family. Early childbearing is considered to be breast protective.
Yeah, I think this is very important. What if a woman, of course she's not married, but she wants to, deliver, then it's after cancer, you think it's possible?
Yes. So an amazing study just came out last year, I would say, where post breast cancer, after a couple of years of hormonal therapy, they stopped the hormone treatment for the woman to conceive, and after conception and delivery, they went back to the medicine to complete the tenure of treatment that one needs to take for hormonal therapy. So pregnancy and pre-pregnancy states, even post-pregnancy, are hormone-rich periods of a woman's life. And as long as you do it right, even if the person had a hormone-positive breast cancer, they can conceive after getting treated for their cancer. The doctor has to work together with the patient to see they're able to give X amount of time. The highest relapse rates are in the first 2 years.
Okay.
So those 2 years have to be avoided, but after that, there can be a period of break. In terms of HER2 positive and triple negative breast cancer, actually they're not hormonally driven tumors.
Okay.
So those patients are a little less limited in their ability to have pregnancy. Once their fertility resumes, they can go ahead to form families.
No, I think this is a very, very important point, because a lot of women have that we can't do it after cancer. And in fact, I know someone who had breast cancer, and she freezed her eggs, and
Yeah.
and she didn't know she was going to get it, because
Yes.
her mom didn't have it, no one, and yeah, she's okay.
Wonderful.
She's like, you never know, because she had passed a certain age, and
Yeah.
I guess a lot of women are freezing their eggs nowadays, because
Yes.
so many are career oriented. They don't want to have it early. They want to maybe later. Some are single mothers. They just don't want to get married. So it's nowadays the world is changing, I guess, in India.
So actually, I don't know if you know, we have a Well Women Center, and
Okay.
it is led by Dr. 𝓫𝓵𝓵𝓸, and she runs an onco-fertility unit,
Okay.
wherein actually they do something very novel. They do ovarian tissue preservation,
Oh,
not
wow.
just oocyte preservation, because that needs a lot of hormone stimulation to the woman, form the follicles, then you store the oocyte, versus when what they practice is actually at, just in a day
Okay.
they go in a minimal invasive way, and they take the ovarian tissue
Okay. That's nice.
and they freeze that,
Okay.
and it can be reimplanted in a woman when the woman is ready to have a child. Several years later, it can be reimplanted, and the ovarian function restarts to have real follicles and to go through a natural process of conception.
Oh, I think this is so good news for all the women out there who have this misconception that they can't do so many
Yeah.
things after
Yeah.
cancer. So ma'am has given so much hope, and so much
I'm myself
encouragement.
very energized when I talk about these things and absorb what new stuff is happening.
Yeah, so I guess new stuff keeps happening, and
Yes.
it's like you all also learn so much, update,
True.
keep learning. I guess it's a ever
Evolving
phase,
process,
yeah, ever
yeah.
evolving, and I guess medical also, and for the mind, body, soul, and from the self-development, energetic as wellness. You see, mental wellness
Correct.
is very important. As
Very
you said,
good.
body is there, but it's also the mind,
Mind.
and the
Mind is most important,
yes,
actually.
more than the body. I
More
guess
than the body,
power
because
of the
mind drives the body.
body, yeah. So
Yeah.
if you think you can do it, you can do it. If
Yes.
you think like you give up, yeah, I realized that in my journey how important it is. So thank you so much,
Thank
ma'am,
you.
for giving your valuable time, as ma'am is so busy. But I was like, no, since it's the Cancer Awareness Month, and I wanted women to know, a lot of information. And please, if any of y'all even have the slightest doubt, just close your eyes and go to ma'am,
Aw.
and you will see miracles. Trust me.
So Natasha, I just want to say this as we finish. I'm proud of being sitting across you, and didn't imagine this day that you will come back, be so complete to sit in an interview and interview me. So congratulations.
Thank you so much.
Thank you for having me.
Thank you.
Correct.